will be done in the best interest of the citizens of this community. For your name we pray, amen.
Amen.
Discussion of the agenda. Are there any changes or additions to the agenda? If not, I guess we need to approve it, say yes.
For the chairman, for the new business, we've already, reappointed, yeah, but we still have to do, Nicole, one more. Could we amend the agenda to go ahead and do Nicole Monroe's reaffirmation?
Is there any objection to that?
No, sir.
If not, all in favor of adopting the agenda, please say aye. So we'll go ahead with Nicole's thing before the public forum.
Yeah, you can come over here.
Can I get a copy of the agenda?
You change your name.
Okay, I'll go slow. Right, raise your right hand.
Thank you.
I, Nicole Monroe,
I, Nicole Monroe,
do solemnly affirm
I didn't refer something
that I will support
that I will support
and maintain
and maintain
the Constitution and laws
the constitutional laws
of the United States
of the United States
and the Constitution and laws
and the constitutional laws
of North Carolina,
of North Carolina,
not inconsistent
not inconsistent
therewith, and that I will faithfully discharge the duties of my office
of my office
as member
as member
of the Scotland County Board of Health.
of the Scotland County Board of Health.
I, Nicole Monroe,
I, Nicole Monroe,
do solemnly affirm
do solemnly affirm
that I will support the Constitution of the United States,
that I will support the Constitution of the United States,
that I will be faithful
that I will be faithful
and bear true allegiance
and bear true allegiance
to the state of North Carolina
to the state of North Carolina
and to the constitutional powers
and to the constitutional powers
and authorities
and authorities
which are
which are
or may be established
or may be established
for the government thereof,
for the government thereof,
and that I will endeavor
and that I will endeavor
to support, maintain, and defend
to support, maintain, and defend
the Constitution of said state,
the Constitution of said state,
not inconsistent
not inconsistent
with the Constitution of the United States,
with the Constitution of the United States,
to the best of my knowledge and ability.
to the best of my knowledge and ability.
Congratulations.
I do these graces.
All right, if you will just sign right here. I got 3 copies. Put the county seal on there. And you will-
I'm not aware of anyone that has public comment. Was there, you know? If not, we'll go ahead with the fiscal update and the administrative reports. Kim?
Good evening.
Good evening.
Okay. Thought it was at a dead church for a second, sorry. I'm sorry. Just a second. Good evening. This is for those of you who do not know me, my name is Tim Martin. I'm the finance officer here at the health department. So, today we're going to go over the finance report as of November 30th, 2022. Okay. So, the first slide, I apologize. Let me go ahead and say this ahead of time. For those new board members or those of you new, this report is not in your packet because I cannot get this information from the county finance office in time to get it to your packet. So that's why you always, get it at this meeting. Okay. Our health department, although we have one budget, you see on that first page as $4.3 million budget, we have approximately probably 18 to 20 budgets inside that budget. Based on the programs that we have, whether it be STD, HIV, or WIC, or some other grant-funded programs. So if you need more explanation of what these programs are, I'll be happy to answer those questions. So I just don't want you to think we're just one big budget. We've got budgets inside of budgets. So this first page is an operating budget. Our budget is $4.3 million. We are currently, as of 11/30/22, we've only spent 1.3. So we should be at 42% expended. We are only at 31.2 expended. So we're currently under budget by at least 10%. Any questions? Any questions?
Well,
Yes,
yeah, I got it. COVID-19 response is 4.7%, and advancing health for equity is 0.4%. I guess one's fading out, one hasn't started up.
The advancing health equity money, we've only spent just the sum of that money so far. There are certain, of course, you all know, once you get grants, they have certain things you can spend that money on and certain things you cannot. Jana Blue, is our person over that advancing health equity. And we're trying to, she's found ways to spend it, we just haven't actually, spent it yet. Please understand that we pay the money up front, the county up front is the expense, and then we get reimbursed from the state for those expenses. It's not, the county sends us, the state sends us all money at one time for a grant, and then they turn around and we have to send money back. That's not how it works. So we have to spend it up front, then we get reimbursed. And we have not spent much of that money yet. I cannot tell you exactly, I'll have to defer to Jana on that program that belongs to her. As far as the COVID, we are getting ready to start spending some of that money. I think we finally have found some people to help with a couple of the grants that we have received. We are actually hiring some people. So as soon as that process gets complete, we'll be spending some of that money.
Neither of those categories that Dr. Carter referred to are in any way jeopardizing, we'll have to return into those funds if they're not used, are they?
Yes, sir.
Yes.
There is one
The
that's,
COVID-19, that particular addendum had a school health liaison position. And it was open when I came here, and I had been trying to fill it. I even asked the county manager about, possible sign-on bonuses, because that was recommended by the state, but he said the county does not do that. But I was able to identify someone, and they will be starting on Friday. Haven't had time to get with you about it. They're gonna be starting on Friday, so they will complete all of their trainings while you guys are out for Christmas, and then in January they'll be at the school.
Not a nurse.
No, it's not, it's the health educator.
I didn't talk to him.
So we had some time, quite some time, but, the state, it just so happened, they sent, an email stating, if you haven't spent it, by the end of December, it's gonna be reallocated to another county. So,
That particular line.
But other line items in that COVID-19,
yes, that COVID-19 line item has probably 4 grants in it.
right.
My guess is that they're loosening up as they go because the money's there, but the need has changed. Yes,
Correct.
no, I mean,
Yes.
the county's dealing.
I have
with
not
this too.
seen any lessening of the requirements yet.
Well, yes, a little bit, like with that particular grant, initially, it had to be a nurse. That was the only person they would let you hire. And now it's more of educating the public, like with the public health educator and community health workers. So they did loosen it up a little bit, but there's still, like Tim said, other grants within there that they have not loosened up.
I'll use an example. There's a vaccination grant in there that was given to us to simply target adolescents and youth. And that grant is still sitting there. And I think we're looking to work with ways to spend that as well. And since on that COVID grant, there's probably 4 or 5 grants that's in that little program.
And the funding, a lot of, all the FEMA funding for COVID that's out there is coming to an end. And by July 2023, it'll be gone. So they're trying to get it used before it's gone.
Also, that $400,000 is also $83,000 allocated for the second payment of our mobile vehicle, our mobile unit that we've ordered. So we paid half down, 83,000 is about to go to the second part of that. Which I did get news, good news about that it's being worked on, and they've got it on the assembly line, and it's being worked on. Actually, we are going next Monday to tour the facility up in Greensboro. So, me and Donna and Amanda, I think, are going up, and Sharon going up to view the, their facility and how everything works up there.
and to see where they're exactly at with
With
ours.
ours.
For that, exactly. Because it's been 2 years. And I know it's been a while. It's been 2 years since we actually put in the plan for it, but them, like everyone else, has had issues getting supplies due to COVID. And, I think actually I talked to the lady up there one time and they had 2 employees who passed away that worked for them. And so they were behind schedule on that. So, any other questions? Okay. The next slide is going to show you the money that's actually coming into the health department. Your first column, your second column there will be federal and state grants that we actually have coming into the agency. Your second column, of course, is Medicaid, and fees is anything we charge for cash money services or insurance. Okay? Once again, 5 months, we should be at 42% collected. We are only at 20% collected. We had a little downturn when we had someone retire in September. We did not have a medical biller. We now have a medical biller in place. Then we lost our insurance clerk who does our medical insurance, and that position is currently getting ready to be filled, hopefully, the interviews for that. So currently we're still a little bit behind, but I will say that our new medical biller that we hired is wonderful and great, and she is actually caught up on our stuff that was behind. She's actually caught it up since she's been here. So we should see the money's coming in next month because, as I know, told you before, the county doesn't give me access to stuff until later, so I don't get those funds in the budget until the next month. Any questions? I will draw your attention to the HIV. I know that looks really big. Sitting out there at 89%. We have had an uptick in HIV cases this year. We've had new patients coming in. Whenever those new patients come in, we do labs, we do their lab work. If they do not have insurance, then we use Ryan White funding through Robeson County Health Department, and they reimburse us. That's why that number is so big. So, and I think if you have any questions about the HIV uptick, Donna would be happy to explain that. So, 4 or 5 new people.
And I'll talk about that with my
Okay.
update. I'm gonna do a little bit.
Is this being observed statewide or just here?
I'll talk about it in my update.
Okay, fine, sorry.
Any questions?
Thanks, sir.
Thank you so much.
Amanda, monthly activities summary.
These were included in the packets. These are the overall different departments, October and November data. If I have any questions on any of the services. Sure. I had sent out, I hope everyone got the October and November reports that I did. I'm gonna try to start sending that out by the 5th of each month. So I'm not gonna go over the whole thing, but I do wanna touch on some parts. For October, we established a direct report meeting. I meet with my direct reports, which is the supervisors, every Monday at 8:30. And this is just to open the communication through the department and reduce any miscommunications we might have. So we discuss any concerns or upcoming events or issues that's going on within the department. Our clinic numbers have been down. They were down when I came because of COVID. We were closed. A lot of our departments were closed, but we're opening back up. And when I looked at the percentages, we are up 70 patients a month since I've been here in June. And looking at the data from April to May and from June to now, we're seeing an additional 70 patients a month. Our no-show rate is still kind of high. Management support's been calling and trying to follow up with the different ones that have missed their appointments and trying to get them rescheduled. Environmental health, I have had several different complaints or concerns called in, especially with permitting. So we have established a complaint form online where citizens can go to our website and file whatever complaints they may have. And our environmental health supervisor attended the commissioners meeting, in November to go over that process. Our billing has improved, as Tim said, we've had some staff, turnover there, but we have went to a super bill and we feel like it is gonna be a little more effective in getting the, claims processed. We have installed security cameras. That's something Dr. Eli started before I came, but they were finally installed inside and outside of the building. I think it was the week before Thanksgiving, they finally installed them. And if you notice when you came in, there's a health department logo with our operating hours now on our door to identify. Because a lot of people that would come in that hadn't been here, they didn't know which store to go to. They would come in through DSS and park over there. We noticed that doing interviews. And we were like, no, this is actually our front door, so we marked that. We still have a lot of staff turnover and vacancies. We have nutritionist, WIC director, environmental health specialist, 2 processing assistant, 1 for the front registration, because Ms. Deb's been very short-staffed up front, and a processing assistant in finance, a social worker, and a public health nurse. And some of these positions have been open for almost a year, or maybe even longer. I'm looking for ideas of ways to try to get more people interested to apply. Like I said, I mentioned a sign-on bonus, but that's not something the county allows at this time. We have gotten a person through the North Carolina Senior Program. They fund that position, they pay the person, and they're working part-time to help Ms. Deb up front. They started the end of last week. And so Ms. Deb's still training with her. But we don't have to pay, but we get the manpower, so we're happy. Hey, Johnson, we have been given the storage space. I think I mentioned it at the last meeting. It's gonna be a few months before we can put our stuff there because they're in the process of renovating it. I've also asked the county manager for another classroom, which he says that we can have. And we plan on doing health education classes out there. And Donna says she would also like to have some satellite clinics out there in that area. So maybe some people that can't get transportation to come here, it's in their neighborhood, they can come later. So that's our plan, if everything goes well with the county, to get those 2 rooms. Any questions?
I don't have a question, but I do want to tell you thank you for sending that to us. It gives us a lot of insight of what's happening with us not being hands-on, so thank you.
Agree, okay, department reports, who's going?
And you all got this in your packet, so I'm not gonna read line by line. You can, Sherry, you can go through here.
One of the things on the previous slide, I would like to say Paige McKinnis is back here. She, just finished her enhanced role nurse position, so we're very proud that she finished
And
that.
that means she will be able to have her own STD clinic and see STD patients, which frees up our mid-level providers to see other patients, other type of patients. So she'll start in January with her own clinic.
Congratulations.
And we are tooting our own horn. We were awarded our family planning grant for $46,000 for the next 3 years.
And to add to that, I meant to say that in my report, I'm sorry to interrupt you again, Don. We were also awarded the adolescent pregnancy prevention grant for another 3 years with $133,000.
Another toot toot. Deb,
Do you have any questions? I'll just let you read it, but if y'all have any questions, this is up front at registration.
That's through health education, health promotion. There's lots of stuff going on, even though these are the winter months at this time. There's not a lot of outreach going on where we're actually out in the community at this time, but we have been. And I think that's October, November, right? Or the months. So we have done a lot. Like I said, and we've reached out to a lot of people because we've had several events that we've put on, but you can see what we've focused on during these couple of months, the trainings that we are going through, that we have to complete, and then just other items that you can see. If you have any questions, please let me know. I'll be glad to share.
Shannon Blue, are you on the call?
Good evening, I am, thank you. I don't have anything new to add. Excited about the refunding announcement for the adolescent pregnancy prevention program. We are at about 40% with our complete of our prime objectives. And we'll be working with the high school in January. That'll go from 40% and proceed very quickly in the new year. And nothing new with any of our other programs.
Thanks, Shannon.
Okay, I'm gonna move right up here beside you, Ms. Goldston.
Sure.
Take my
You can do it right around the study and go.
No, I need to be able to see the slides. I don't like sideways. Okay, so for those of you who don't know me, I'm Donna Page. I'm the Director of Nursing here, and for those of you who don't know, we are an accredited agency, and we go through accreditation every 4 years. And when you see North Carolina Local Health Department accreditation there in activity 2.4, this is one of those activities that we have to do annually to keep the Board of Health informed of our data and our communicable disease, STD, that in our Scotland County. And of course, it's 2021 data because 2022 has not completed yet. So because of COVID, we will actually do accreditation in 6 years this time. So because of the 2 years of COVID, they gave us a little leniency there, but we will still be accountable for some things for the 2 years that COVID took us down a couple of notches there. But they are doing it 6 years instead of 4 this time. So you'll get 6 years of STD, CD updates. So go ahead and go. So, and you got this in your packet, so I'm not going to go through everything. I am going to talk about, I'm just going to summarize basically, because at the end of each section I have a summary. So as always, chlamydia is always our leading and most prevalent STD. With that reason being, it's a silent STD, not usually any symptoms, usually discoverable because females go get tested 9 times out of 10. They're the ones that are getting checked. You can go to the next slide, Sharon. And right behind that is gonorrhea, of course, chlamydia and gonorrhea. Our rates are ranges for ages 15 to 39. So you can see there. Now, when I look back at 2020 data, actually the age range has spread out a little bit from what it was in 2020. Our age range in 2020 was 15 to 29. So it's spreading, the age range is spreading out a little bit. I don't know exactly why that, but the most prevalent, go to the next slide, race is in the black population and in females. So again, it is in females because females are the most likely to go get checked for things, and that's where chlamydia is found. 9 times out of 10 or the STDs are found. So you can go to the next slide. And again, most prevalent in the black population. And we, again, don't have many Hispanic people in this county. You can go next to the next slide. And go to the next slide. So here are STD rates compared to the state. So you can see we trump the state pretty much, except syphilis, which is pretty amazing considering we're right next door to Robeson County. They always have very high syphilis rates. And we're just barely above the state rate for Scotland County. So we have some syphilis, but nothing like our neighbor. The chlamydia, gonorrhea, yes, we definitely.
These are like numbers per 100,000.
100,000. Next slide. So I've already summarized all that. You can go to the next. So let's talk about HIV. So HIV data, the last actual full data report, I don't know what COVID did, but for some reason, this HIV is one of the data sets that is not as current as the others. They have quarterly reports, but they don't have a full data set for 2021 for HIV. So some of this is coming from quarterly reports. So you can go to the next slide. So I went back and again, early, and I'll talk about this and then we'll talk about this year. We need some help in Scotland County, first of all, before I start all this. So when you look back at 2018, now this is a total. We've got 6 AIDS, 3 HIV. That's a total of 9 cases. It's not 3 out of the 6. It is 9 cases, 13 cases, 11 cases, 11 cases. At the beginning of 2022, we had, was it 8? And we just had another one.
8, yeah.
So
8 of which?
we had in 2022, we had 3 AIDS.
3 AIDS.
5 HIV, just had another HIV. Yeah.
So to clarify, tell me if I'm wrong, but HIV means you got a positive test. AIDS means you're sick.
AIDS means your CD4 counts are,
You're
Yeah.
in worse trouble.
yeah. And once your clot, even if you get better and your counts improve, you're still always considered AIDS. It never reverts back to just HIV anymore. Once it's AIDS, it's always AIDS. That's how the CDC defines it forevermore. Once it's AIDS, it's always AIDS. So, yeah, so you can go to the next slide. So here is Scotland County and North Carolina. So, yeah. So the Southeast is traditionally always higher for HIV, just in general.
The southeastern part of North Carolina?
Southeastern part of the
Country.
country.
Okay.
There's even now an actual day for AIDS and HIV awareness for the South because it's so prevalent in the South. The funding that we get, first, we used to get funding through RHCC, and it was federal funding. And then they have their clinic across from the hospital over there. Well, when we first got our funding from them, they didn't have a clinic in Scotland County. And so we seen the patients here as a subcontractor. And they opened their clinic, and so they wanted their funding back over there, and they wanted to see their patients, so they basically ended the contract with us. So we went with Robinson County, which is known as Dogwood, and they have state funding, which is Part B. Little bit different in the way you can use the money and things, but we have tapped out. Our new money doesn't start with them until April, and we have already used all the money that we could use from them. We cannot accept any new HIV patients at the health department right now because we don't have the money.
So it could be more.
So now, I just think this is terrible to me. You know, we try to look at it, and, you know, we have an HIV case manager who's wonderful. She works with these people, and she is doing all she can to make sure that they if they qualify for insurance or Medicaid, trying to get them funding. You know, if they have insurance, we can see them because we can bill their insurance. But the money that we get from Robinson County is money that is paying for people who don't have insurance. And that's the people who need it the most. So, they gave us a little bit more money, but basically the patients that we have right now, it paying for their lab work that they get every 3 to 4 months. Their meds are paid for through other funds, so that's not a problem. It's usually the lab work. We've gotten LabCorp to work with us to give us decreased rates on the labs for them, for the Ryan White program. But yeah, we're gonna need to be trying to find some other ways to get some funds for this program. I'm afraid if we don't, and they're looking, Robinson County Health Department's looking at giving us more money in the next budget year, so. But eventually, and I even think Robinson Healthcare Corporation is, not accepting patients because their money's running low. So apparently it's not just a problem for us, it's a problem everywhere. The money's just not there.
Are you hearing that from other health departments in the area?
No, I mean, the patients, when we have patients that come in and test positive in our county, we're referring them to First Health or Shrayheck, which are the 2 closest places for them to go if they have transportation. They can go to Lumberton, the RHCC there. This one, RHCC here now, is doing telehealth because they don't have a provider in their office now.
And the one here is not accepting new HIV patients because they're doing telehealth. So they only have their established patients. Robinson County Health Department is not accepting new HIV patients. So it's, with this new one we had, it was tough finding him a place to go.
So there's a need. Just so you all as board members are aware, there's a need.
Sometimes I wish the funding like COVID that's not being used.
Yeah,
could
I
be-
mean, there's
could
always
be,
money.
You know,
You can't do anything
COVID
with
is
it.
not a problem, could be used for that, but they won't let you set that money.
Well, but have we turned anybody away?
We find them another place to go, but we don't have a way to.
Service them.
The money is fungible. I mean, some of these line items we should be able to move funds from, I understand some of the grants are restricted, but
No,
we just had a bolus of people we weren't expecting. We had more than we expected.
Yeah, and it's the initial labs are the worst of it. You know, when they come in, they're very expensive and it eats up a lot of the money really quick. But, you know,
I hate to interrupt, but Tim.
okay, we're going.
Tim just texted and said that, we'll be receiving a 30,000 budget beginning April 1st.
Yeah, and they gave us 15 last year, I think,
So it doubled.
they're gonna double it, so hopefully
That's from Robinson Healthcare Corporation?
no, that's from Robinson County Health Department. Yeah, that's the Part B, so hopefully it'll be better next year, but at the rate that this is happening, and then we got to look toward, we got to go toward prevention. And so then we're looking at the PrEP clinic, which is something we were trying to start before COVID hit. And I even, came before you guys and talked about PrEP clinic and getting that started. And then we're still gonna run into the same problem, that people can't get on PrEP because they don't have money to pay for the labs. So we've got to find funds to help pay for labs for people to get on PrEP meds. I think there's some money floating around in the federal budget that hasn't completely been finished, so, but more to come on PrEP. And, but we've got to start focusing on prevention, which is what public health does, is prevention. And maybe we can work on some of this for the coming year, 2 to 3, getting some of these rates back down. Because we definitely have a need in this county to work on these infection rates. Okay, sorry.
If you don't mind, Jonathan, what happens if a new AIDS patient hits the hospital system, this network, do you know? Are we seeing them or are we sending them out?
We've been seeing them as much as we possibly can, but The problem we run into is we don't have the resources to do the labs that need to be done, to really have we have a tendency, well, from out, to refer them to the local health department, whether the county they have to live in, and then we fall back in the same problem again.
Yeah, it does, because there was, yeah, that's what. Okay. And we were ranked number 3 in the state in 2020 for newly diagnosed HIV rates, and number 5 for newly diagnosed stage 3 AIDS rates. And vaccine preventable disease, we can go ahead and shoot through that. We didn't have that many, we had 5. Not a whole lot there. For vaccine preventable disease, low case counts, hepatitis B was 60% of those. Communicable disease, you can go on fast forward through there. Again, Hep C, that's a reflection of Scotland Correctional. They test everybody that comes into Scotland Correctional, and 88% of that's the hepatitis C is Scotland Correctional. Majority of them are 30 and older, predominantly male, again, Scotland Correctional. But again, other than Hep C, we don't have a whole lot of communicable disease to talk about. We had 2 TB cases in 2021. Go to the next slide. Go on. And COVID-19. So 2020, we had 2,687 cases. 2021, 3,989 cases. Deaths in 2020, 62. Deaths in 2021, 57.
County residents.
County residents.
They may have died in Charlotte, but
Yeah, they may have died somewhere else. The age, there's the age range for the cases. Most of them 30 to 59. And then there's the gender, not too far off. You can go past that. Slightly higher in the black population, and it was back in 2020, it was slightly higher in the white population, so it shifted a little bit in 2021. Go back, go ahead. And then the death demographics in 2021, so you can see they it's balanced between male and female, and mostly in the mid to older population. You can go ahead. Yeah. That's that. Oh, and that's just immunizations that we gave in 2021. I thought I'd throw that in there. And that's it. Any questions?
yes, who did the slides? Did you do the slides?
I did.
Pretty.
Thank you.
Nice color combination.
I was getting ready to change it there.
Oh.
It took effort to do that.
Okay, unfinished business, I'm not aware of any. New business, we've done the oath for our new members. Thank you. We just did we don't have a report, she just did, so we've done that too. Reduction in force policy. Amanda Deaver, I really didn't know what RIF meant until now. I was in the military, you got RIF.
So we've been in the process of updating some of our policies, and this is the policy that hadn't been updated since 2019. The purpose of this policy is if conditions arise within the organization, such as reduced patient revenue, county appropriations, or state revenue that might necessitate the elimination of one or more programs or positions, this is the policy we would use for the reduction in force. Now, it was in your packets. Do anybody have any questions on it? It's the same I said we updated it, but the only thing that we've done is just pretty much change the format and the wording. But it's still the same.
This is the old version, but this is the current version.
Yeah, that's the old version. In 2019. Any questions?
So this policy, we need to adopt? or-
Yes.
Okay. So y'all have a motion to adopt this RIF policy, updated RIF policy?
Make a motion.
There's a second. Is there further discussion or anyone want further clarification? If not, all in favor say aye. Opposed? Thank you, Amanda. Now, it's got my name by this next one, so how that can be. Orientation and ongoing training policy.
So with our current Board of Health training and orientation policy, I felt like the latest version here is just it's vague. It's very generic. It doesn't really go in depth as far as the extensive training that Board of Health members actually participate in. I don't know if you have the draft version. The draft version offers more detailed information in regards to the type of resources, training resources that are offered to the Board of Health members. It pretty much is very procedural. It gives you the rundown on how that the new and current Board of Health members are going to be trained and continue to be trained. We will be working next year, hopefully having someone, hopefully we can get in contact with Ms. Moore to come back from the School of Government to do an in-person training with Board of Health members. I'm pretty sure we probably need a refresher. With our new members, Ms. Golston and Ms. Stephanie Littles, your training is very crucial. It's very vital. Your training will actually open you up into what constitutes the Board of Health, what authority the Board of Health has. So I will be getting with you probably tomorrow. But this draft version, it's just really more in-depth information. Nothing in the old procedure, the old policy has changed, but this policy, it just offers more detailed information with your training. And it will be an electronic version, which I'm working on that now. The Board of Health Training Handbook and the Board of Health Bylaws and Procedures will also be accessible electronically. And if you would prefer a paper copy, just let me know. I'll be more than happy to email you the PDF. But hopefully the electronic version, easy access. That's all.
All right, so this is an updated document as well, an updated policy. I see it has a place on top for the health director, the board chair to sign. I assume we need to adopt this too or discuss it further. So I'll take a motion to approve this change in policy.
So moved.
Is there a second? Any questions or further comment or discussion of this document?
Is there a deadline that we have to finish this?
No.
No, it's just ongoing?
Oh, with the ongoing training?
Yeah.
Yes, now with ongoing training, if you would, with the ongoing training, we kind of want to do more of a group format. We know the majority of our board members work. And I know it's hard, trying to get these trainings in, so we're willing to work, with board members on a case-by-case basis, but it's over a 12-month period, so you have plenty of time to get your trainings done. Now, for the in-person trainings, of course, we would try to have those trainings done before a meeting or during a meeting. It just depends on the, type of content that's involved.
Okay. I've done a little bit of electronic stuff. What sort of, time commitment are you expecting from board members to do this training? And is there some way we can?
It would
make work?
definitely, we can accommodate you as best we can, Dr. Carter.
No, I mean, is there a certain number of hours of this stuff?
No, you talk about like CEUs or?
No, I mean, is you sit down and look at a video and the video plays for an hour and then they ask you 4
Oh,
questions about it?
Each video or each training is different. I think last year you were exposed to some trainings that I sent out, through the School of Government. And each module, 30 minutes, it could be an hour. You may have a training that may have 6 modules that you have to complete. And then you have to complete all the modules in order to get a certificate. So it just varies.
And being on this board for 6 years, that was the only time I've ever been asked to do anything of that sort. So, I mean, we were given a handbook, we flipped through it, and it's not, and I guess some of this is good. And some of it's probably too much, but.
It could be over-informative, but once we get the handbook, hopefully I have mentioned this to Amanda, but kind of wanting to do a different version of the handbook, kind of give it some zhuzhing, instead of the black and white version, try to make it a booklet or something, a visual aid that we can have instead of this black and white. Get some color to it.
Well, I'll call for a vote here because it's 7:17, but I will tell you that I found effective that the board of trustees, we're not meeting as often. The board of trustees at the hospital meets, they have anywhere from 5 to 20 minutes of education about something that we may not know about our
Right.
job as a trustee,
Right.
or about some department of the hospital, and maybe we could just take 10, 15-minute educational session at each of these meetings and kind of get us all on the same page.
That's a good idea.
That's just a suggestion, but any further comment or question or discussion? If not, all in favor say aye. Opposed? And thank you, Sharon, for
You're welcome.
putting that together. Meeting schedule and proposed new meeting start time. Oh, we got bylaws and standard operating procedures. Is this updated as well?
Yes, this is updated as well. I felt like the current version was, it wasn't fluid. It wasn't flowing. It included information that shouldn't have been in there, in different sections where it may talk about, if there's an agenda section and you're reading stuff about minutes, this version here is more, it's more understandable. It's updated language. I think the version we have now, our operating and bylaws, have been updated since 2019. And then when COVID hit, everything just came to a standstill. But there were things still being updated that we didn't know were being updated until 3 months ago, dealing with Board of Health. But as far the Board of Health handbook, the bylaws is all statute. So none of the statutes, to my knowledge, have changed. It's pretty much all statute. But nothing from the previous version has changed as far as the word. The format just changed. And it's
just cleaned it up.
user friendly.
You're saying that you cleaned it up a bit.
Yeah.
Updated, okay. Any more comment on that? Well, I'll take a motion that we adopt this as well. You're saying that no significant change at all?
No, sir. No, sir.
I'll entertain a motion that we adopt this as well. I got a motion. For a second? Any discussion? I will note that you have some blank here on meetings will be held on whatever on my
Yes.
copy.
That's, the meeting notice that will go out, or the format that goes out to the public.
So that doesn't need to have anything.
No, sir.
Okay.
No, sir.
All right. All in favor, say aye. Opposed? All right, thank you. So we got those three action items taken care of. Yes,
You didn't address the meeting schedule.
meeting schedule, proposed new meeting start time. At this point, we've been meeting every other month and we have a schedule here. And it says 6 PM. We've been doing 6 PM?
No, sir, we've been doing 6:30, but, it was a suggestion made to me to bring to the board that the start time be amended to 6 PM instead of 6:30.
If we get out earlier.
Maybe did I make that suggestion?
I think you did at our last December's meeting.
Okay. Alzheimer's. Okay, we don't really need to vote on this at this point.
Yes, you need to adopt the new meeting
Okay,
schedule.
all right, we're gonna do that.
So
It's a public thing.
So,
Second? Any further discussion? All in favor, say aye. Okay. I'll keep reading the agenda, so I'm not skipping a line. Discussion of 2023 chairman and vice chairman nominations and selection of nominating committee. Well, I know it's that time, and I'm open to hear from the floor, but I thought I would nominate the previous chairman and vice chairman, Diane and Nicole, as a nominating committee. And maybe we could potentially do this in February, we'll come back in January and have a special meeting. So any discussion of that? If not, we'll, if the two of you agree to work together as amicably as you did before.
We would, I wonder about this. Is there any chance of just, would you consider, being the chairman for the next year?
I would, I just found out that I can be reappointed, it depends on the county commission reappointing me.
Is that something you want, is that something that the rest of the committee wants to consider?
I don't, you know, we went through this a couple of years ago,
Yeah.
and it was, we were told that we're just a small county and we can just kind of do what we want to. We really don't have to follow the rules. I don't really think that's how we want to operate. We got bylaws that say do it this way, we do it this way. So the foregone conclusion is fine. If some change comes forward, that's fine too. And then you have the special meeting, there can be nominations from the floor.
I agree, Mr. Chairman, let's do it right.
Let's do it
Nominate.
according to our bylaws, exactly.
Do your work, come back with a report, even if it's the same.
So you two happy to do it?
Yeah.
Okay.
And I will send you the contact list
Okay,
of board members with their contact information.
okay, if, I don't know, Nicole, I don't know how you feel, if anybody wants to be involved tonight, let us know before we leave. We'll ask them, we'll ask you to take some tonight if you don't want.
I'll stop you.
Huh?
I'll stop your phone.
Okay.
Any further discussion on that item? If not, informal discussion. Help me figure out what vacancies we now have and have we filled them all. We're absent a dentist and we have a person filling the dentist seat.
Yes, Ms. Golston,
Ms. Goldston.
she's
okay.
standing in as a public member in the dentist seat. Once there's a dentist identified and the BOC appoints them, then Ms. Golston will.
Do what? I'm just curious, I'll wait for the next word or two.
However, the board of commissioners choose to move you, or they may find a place for you here, as I think we do have another public member vacancy. You may
Right now,
be transition. Yes.
It's just coming up with,
One registered nurse, one licensed physician, we absent dentist is the public member now, optometrist,
Dr. Boland, he's not here today.
okay, veterinarian, maybe, pharmacist, Charles, county commissioner, engineer, Rayleigh's still with him, and 3 general public members.
Correct. Those make up the 11 members of the Board of Health.
who are our 3 public members?
Currently, we have Mr. Matthews, we have Ms. Bean, and then we have Beth, but Beth is coming off of the, she resigned.
And Ms. Little.
I think Ms. Little's replaced Beth.
Right.
So we have our 3rd public member seat.
So where's the vacancy that you referred to?
The vacancy will be, hopefully, you applied,
You said
correct?
there's a public vacancy.
There needs to be some discussion about one current public
Okay,
member.
I think I know what you're saying. Yeah, I think what's been said is Mr. William Matthews' seat, is filled, but Mr. Matthews has not really been able to attend.
So those decisions were made by the commissioners.
Yeah, but I think this board has to send it to us to
Yes.
say they violated attendance or whatever.
And the reason why I said that, I've been speaking with Mr. Matthews, and for everyone that knows Mr. Matthews, he is 96, 93, 94 years young.
Heart is in the right place.
Yeah, his heart is in the right,
He's not quite,
he's in his mind.
I thought he was 90. I didn't know he was up in the 90s. He always
And
told me.
I could have his age incorrect, but I know he's in his 90s.
Yeah, he is in the
But
90s.
I know he has, other, things that he attends to that prevents him from being in attendance at the Board of Health meeting.
So who will discuss with him what his intentions are? Will that be you?
The way the process works is the board chair will reach out to him, and if he wishes to reaffirm, or if he chooses to resign,
Do we know where he is on his 9-year cycle?
Mr. Matthews should be reappointed this year, if I'm not mistaken. I'll have to go back and look or check with Jason. I think he's up for if not this year, maybe next year. I know it's soon.
Well, we can get together,
Mhm.
I'll, not waste everybody's time, figure some of this out. Not Levine, although he says he wants to continue, he's not attending.
I don't know if the last time if you were able to get in contact with him, when we had this discussion.
I did talk to him and it sounded like he wanted to stay, and Beth definitely wanted to get off. But, so attendance is still an issue. So I'd be glad to call him again and
Yes, sir.
help me.
So what about looking for a dentist? Who does that?
Well, currently, the commissioners has created a new process where the applications are electronic. So, any Scotland County, dentist who is interested in being on the Board of Health, all they have to do is simply apply. Those applications are reviewed by the commissioners, and whoever they choose to appoint to the Board of Health, that's who we'll have.
So how
They
are
might not know.
Do we have a
they?
dentist who lives in Scotland County? We have fewer and fewer doctors, just want to Scotland.
And we don't have many dentists. Myself and another commissioner spoke with a dentist, one, but we've not got any confirmation from one who actually lives here yet.
And back in the day when I was appointed, I didn't fill out an application, and I remember
Right.
6 years ago, it just happened.
Mhm.
So whether commissioners.
And now they do an application and we appoint it every meeting if there are vacancies.
Okay.
Yep.
So what I wondered is how they were approached, how were the dentists, how were they approached? Because, you know, I don't know if anybody's just looking to see if there's a position open on the Board of Health. So how are they approached? Are they approached by one of the commissioners or?
If we do that, previously, I don't think no one has, but here lately, we've been trying to be more aggressive in reaching out to those people,
So
potentials.
are there not any dentists living in the
We're
county?
working on researching, doing more research.
I think there's one down at Village Family Dental. There's at least one that lives in the.
That's the one that we just sent a letter to this week. So I'll get with Ms. Coxon. And we're working.
And he's a young dentist too. Really?
I know there's an old one, but he's probably been approved.
Well, he might, yeah. There are at least two that live in the county, man,
All right.
that work down there, yeah.
Well, it's 7:31 and we have some more business to do. But I don't want to cut it off. There's something important somebody needs to say. However, we need to go in a closed session. And for that, the reason to go into closed session to consider the qualifications, competence, performance, character, fitness, conditions of employment, or conditions of initial employment of an individual, public defender, or employee or prospective public officer or employee under General Statute 143-318.11A6. I think I'm supposed to read all that.
You are exactly right.
Public offender, we're not gonna talk about an offender tonight. And I have a motion that we go into closed session.
So moved.
Is there a second? All in favor, say aye. Is there, who gets to stay?
All board, if you're not a board member, kindly, we thank you for attending this evening's meeting.
Appreciate it. 2 minutes overtime, you all were here.
Amanda,
Am I supposed to stay?
yes, ma'am. Yes, you're a board member.
Well, it sounded like there was a place according.
No, Ms. Golston, what happened is, in our